Goal! Let's take a look at Cristiano Ronaldo and figure out if he's had any facial plastic surgeries, or is he really naturally that good looking? All estimated costs and a before and after photo are revealed later, so stay tuned. In 2003, at the age of 18, what I see here is that Cristiano has short upper and middle thirds of the face. He has a minimal nasal dorsal hump, and at baseline he has upper lip arching with upper tooth show on repose when he opens his mouth. Make sure to watch our video on what all models have in common to learn more about this phenomenon. Also, Cristiano has full lateral cheeks and the medial cheeks appear flatter. Notice his jawline at the angle of the jaw and pay special attention to the slope from the ramus of the mandible all the way down through the body of the mandible. We'll be coming back to that later on. In 2004, at the age of 19, what I see here is that Cristiano has temporal hair that has nicely framed his face. And this is a major part of male pattern hair loss, actually. When the temple starts to recede back, it's not so much that we're just getting the corners revealed, but also the entire face starts to look broader and the whole forehead starts to open up as the temples push back. But as you see in Cristiano's case, he has really nice anterior projection of those temples, giving him a very youthful look. As a side note, since 2019, Cristiano Ronaldo actually co-owns a hair transplant clinic in Spain. I found that interesting. Ronaldo also has a prominent masculine brow bone. In 2005, at the age of 20, Cristiano has full tooth show on smiling, and it's clear that he's had a full smile makeover. He's had a series of veneers placed, and when you compare back to 2003 and 2004, you can really see what a major transformation has occurred. In 2006, at the age of 21, I don't see any changes, and this is the same through 2009. In 2010, at the age of 25, the major change that I see here is that I think Cristiano may have had upper and lower jaw implants. It's likely that there was a malar cheek implant placed as well as a gonial angle implant. It looks to me like he's had a filling in of his medial cheek volume deficit. Now, could he have had filler instead? Sure, that's always an alternative option for filling in the cheek area, but it looks to me like the appearance of the cheeks look about consistent throughout the years to come. So I think that it's possible that he may have had an implant. Also, when you follow the ramus of his mandible down through towards the body of the mandible, what you will notice here is a contour change. It looks to me like there is a lateral bowing of the area as you reach the angle of the mandible. Compare that to prior, where the overall slope and contour appears to be bowed in. Now there's a bowing out of that area, and so that to me is a major change in Cristiano's face. He may have had a off-the-shelf type of implant where you just buy a pre-made type of implant that matches the overall shape that you're going for, but he also, given his resources and given his status, he may have had a custom 3D type of implant that's prefabricated based off of a CAT scan to actually fit the face as perfectly as it possibly could before you go in for surgery. So you have this custom type of implant that then gets placed into the area right over the jaw. When it comes to facial implants, the incisions that are used for placing these implants are usually done on the inside of the lip, both on the upper lip to get to the maxilla or the upper jaw, and on the lower lip to get to the lower jaw. And so you're not going to see any scars from the outside. You'd have to really raise up the lip or lower the bottom lip to be able to see where these incisions were placed. So it can be very difficult to detect that someone's had this type of work done. Also, the question becomes, well, why even get these implants? And what's the purpose? Is there a functional purpose? Not really. Is it just for aesthetic gain? Pretty much. The thought is that if your jaw is a bit more prominent in the angles, and if the upper jaw has nice fullness to it, you'll look less tired, you'll look more youthful, and also more masculine. So that is most likely why, majority of guys who are getting these type of implants are doing it in the first place. I find it interesting that around 2009, 2010, Ronaldo actually signed for Real Madrid in a transfer worth 94 million euros. Could these potential procedures have corresponded with his growing popularity and worldwide fame around that time? Let me know what you think in the comments below. 2011, at the age of 26, I'm not seeing any further change. Same in 2012. Compared back to age 18, you can see that in this photo from 2013, the outline of the potential malar implant is quite visible. In 2014, at the age of 29, it looks like Cristiano may have started on Botox to the forehead, the glabella, and the crow's feet. He now has smoother skin to pair with his effective skincare routine. Now, when performing Botox for men, you have to keep in mind that the muscle that you're injecting into, in the case of the usual locations, right, the frontalis muscle for the forehead, the corrugators for the glabellar area, and the orbicularis for the crow's feet, they're usually stronger in men, and typically what that translates to is more units of Botox for the same effect. So it's very common when a guy comes in for Botox, he would typically get underdosed by a clinic that is performing a lot of Botox, say, mostly on women. So there has to be that dose adjustment that occurs so that the muscles that you're seeing on men, especially men who are using their muscles quite often and athletes, need to be dosed properly to get the same visual impact. In 2015, at the age of 30, I'm not seeing any change, and that is the same all the way through 2022. The total cost of Cristiano's potential procedures is $140,000. And here's a before and after. Hey guys, Dr. Gary here. So I'm going to do a reaction video to this video posted by Matt Dominance, and I've seen some of his material, and he's definitely a thoughtful guy, knows a lot about the hair world. He's not a surgeon, but he's an enthusiast. Let's watch this video on LeBron James's hair transplant, FUE, FUT, concealers and more from March 2021, because I've been hearing a lot about, LeBron James and his hair, and can you comment on the hair? And I think Matt put together a nice video. So let me take a look at it and tell you guys what I think.
Welcome back to the channel, where I'm going to be talking about LeBron James and how he got his hair back, his several hair transplants, FUE and FUT hair transplants, his hairline comebacks, several of them.
Oh yeah, look at this. You can see LeBron James there, and it's pretty clear that he's thinning quite a bit in the crown, mid-scalp, frontal area, and it looks like maybe he had a transplant just into this kind of frontal zone at the hairline, at least at this shot here.
When his hairline literally came back from the dead, then he lost his hair, and then the hairline came back again several years later. I'm going to be talking about that as well. I'm going to be talking about his use of concealers and hair fibers, which I think he's a big fan of. Second important thing to do if you are considering a hair transplant in 2021, make sure you visit mattdominance.com, where you can get a bunch of free articles, one bead in Turkey, bead worldwide. Very good information. I highly recommend. So make sure you visit my website.
So I guess he's like a consultant for people interested in hair transplants. And I've spoken to Joe Tillman, Spencer Coburn, and and some others. And I think there is a role for people who are not transplant surgeons, but kind of serve as liaisons for patients considering transplant surgery. Because it can be hard to figure out, like, where should you go? What are the important steps? And I still think that patients should feel comfortable finding a doctor and trusting that doctor for the primary advice. But from a surgeon's perspective, I don't have all the time in the world to sit with someone for hours discussing all of their options.
Approximately 10 hours later.
Consultations in my practice 30 minutes, they're packed full of information, but some people need even more time and they need to research more. And so I do think there's a role for kind of these hair transplant consultants, if you will. But the caveat being that they're not transplant surgeons, and so the perspective is definitely different. They're not going to be the ones to take on the responsibility of treating you, and so it's a little bit of a different perspective, but nonetheless, it's a valuable one.
Now let's talk about LeBron James. He started developing the first signs of hair loss, as you can see already here, in 2005, and it started pretty much like progressing from there.
So he's showing 2005 at 1 minute 41 seconds, and yeah, what I'm seeing here is that The anterior hairline in the center, it looks like it's still at a pretty good place. I don't see it recessed in any significant way. I mean, I'm sure it's more than when he was 18, but it's overall at a pretty good height. But you can see the frontotemporal area starting to recede quite a bit, and you can overall just see a thinness going on in the frontal mid-scalp compared to, for example, you know, this kind of parietal side part of his hair.
Like year by year, in 2008 we have seen that he's losing the definition on the corners, and his hairline also probably doesn't have that high density anymore. If we go to 2012,
yeah, so right here, I guess he's saying this is 2012. You can see that he went from a kind of a pretty natural looking peak here in the frontotemporal region to something that's a lot broader, and now it's starting to kind of create more of a hollowed appearance and more even circular as opposed to kind of a more natural point. It's starting to get kind of really pushed back even further, and then that central area starting to get more narrow.
We see that his corners are going even higher, and I think it was like 2014 we can already see him being like a really good Norwood 3 with some diffuse hair loss already starting to appear on his corners and starts to progress towards the mid scalp. 2014 was probably the last year as we remember like LeBron without hair on the front or with this type of thinning, because in 2015 we already can see him with a pretty defined hairline. Like that would be considered like the first comeback. Now, how can I tell for sure that LeBron James got a hair transplant? Well, this is a screenshot from a video where his barber was cutting or trimming his hair. And
oh yeah, this is a pretty telling picture here at 238. You definitely see a linear scar, which honestly that is not like a very standard location for an FUT scar. It could have been, you know, I don't know why they would have picked from there. That's not really considered the safe donor area. It's a little bit too high and too far to the side. So I don't know if that's maybe from a prior injury. But then lower down where Matt has the black kind of dashed line where you can see FUE dot scars there in that area. So I think that's an FUE procedure. I'm not sure where the red arrow is, if that's truly from an FUT procedure or if it was from prior trauma, because I think he's gotten into different accidents probably over time, just, you know, given the sport, you know, that he's in. And I think there was one incident where his head hit a monitor. I remember he had a wound from that.
Logan, good hard foul. And James just lost his balance. And just goes crashing in. And hit his head right on the camera by the lens. LeBron James spins baseline and is fouled as he goes inside. It's been a more physical game as James goes down and holding his head.
Maybe that's from that accident. I'm not sure on that, but let's see what Matt says here.
Trimming his hair, and you can see the red arrow shows the FUT scar, like pretty small FUT scar.
Yeah, it just wouldn't really make sense. I mean, I'm sure he probably went to a really good surgeon. I can't imagine going to someone who doesn't know what they're doing. First of all, FUT wouldn't be the first choice in this day and age, and even in 2015. Secondly, that's just not a standard location for an FUT procedure. So unless they just did a smaller FUT procedure to potentially just fill in the frontalmost area instead of doing like a larger surgery, that might be possible. But yeah, I'm not completely convinced that that's from surgery. It may have been from trauma.
From a previous strip surgery, and the black arrow shows us another area below the scar where we can see these small dots, white dots, which come from another hair
I
transplant.
agree that that's from FUE.
This time FUE hair transplant.
Yeah, I agree with that.
This is like follicular unit extraction where they isolate follicle by follicle and then extract these follicles from your from the back of the head, but also from the sides, but in his case mainly from the back. I don't know which hair transplant was first or whether he got FUT and FUE combined in one session. Theoretically it's also possible, but I think he got it done one by one. I wonder why he didn't get a scalp micropigmentation on the strip scar and also on the donor area. He might have done like a 2000 to maybe 2400 2,400 graft hair transplant.
Yeah, I don't agree with that estimate. 2,000 to 2,400 would be, I think, way too high for that area that he has kind of in red there. I would put it at closer to maybe 1,200 to maybe 1,600 tops. I mean, you wouldn't need more than that, especially with very curly hair like LeBron has. I do not think he had 2,000 plus into that area. I think you can get away with a lot less than that, so I think that's an overestimate.
It was his first hair transplant, and this is the area which I think was the biggest focus, as you can see here. And the photo below here, guys, I think this is already after his transplanted hair started to grow, and obviously some additional use of concealers and hair fibers.
Yeah, keratin fibers are very commonly used by people. They definitely help kind of set the base to reduce that kind of see-throughness of the scalp. The alternative would be scalp micropigmentation. I know Matt mentioned that for using it for the donor area where the FUE scars are, or that linear scar that he has, but they can also be used at the kind of frontal mid-scalp area. It's more effective when you already have hair there, I think, than when it's just like there's no hair and you have like a two-dimensional SMP or scalp micropigmentation tattoo there. I don't like that on like a bare scalp. Some people like that look, and that's fine, but that's another option for LeBron if he's relying on the keratin fibers at this point.
Derm match, which is something more like you apply it on your skin, and then hair fibers you apply only on your hair, so maybe a synergistic effect between like a hair transplant, hair fibers, and derm match is this photo here. Because honestly, if we look at him here, and this is from 2015 from the movie Trainwreck, this is not achievable with a hair transplant, obviously, and this is like a synergistic effect, hair transplant plus hair fibers plus like concealers, like derm match.
Yeah, I agree that the appearance of the hairline there, it doesn't look very natural to me. It looks too perfect, and I don't think it's too perfect because of a poorly executed hair transplant. It looks like there is some concealer there, so I agree with Matt on this one.
Combining all that together, and especially if you have like very dark hair or black hair in particular, it's very easy to use hair fibers to make it look natural as well. And this is his progression in his transplanted hairline.
Yeah, this is interesting. So let me take a look at this at 444. So you can see a lot of thinning at that topmost photo. Pretty impressive, yeah. And then as it's going further, I guess as time goes by, he's been getting more transplants. And yeah, I mean, I think it's helping, but you can see those kind of patchy areas that are still there. The area right in the front looks a little bit stronger, and then it just starts to get weaker as you get further back. Again, in this region right here, he did not get like 2,500 grafts. I think probably the 2,500 grafts could have been used to get a lot further back, but for some reason there's still quite a bit of patchiness.
As you can see here, the picture number one, we see like no definition in the frontal hairline whatsoever, although I think already that this photo was already after his hair transplant, because here the photo number two, we can see already how his hairline is thickening, and with the photo 3 and 4 we can already see a much better definition also in his frontotemporal triangle here, okay, on the photo number 4. All right, so after his first hairline comeback from the dead, we can see him with a big drawback in 2018, where he was like accidentally captured during the game with one of his teammates. Here we can also nicely see how his transplanted area was left and was like spared from hair loss, because this hair comes from the donor area, from this donor zone, which is like more resistant to DHT, to androgen action and their miniaturizing effects.
So if he only had an FUE procedure, based on where those extractions were and the fact that they didn't go onto the sides of the head, and looking at the spacings that I saw, it doesn't look like he had such a big procedure the first time. If, however, that additional area where we see the scar, if that's really from an FUT, then potentially you can get numbers, you know, close to 2,000 plus. Otherwise, if it was just those FUE areas where they took the hair, then I think he probably had something closer to 1,400 or 1,600 grafts for this frontalmost area.
Was able to be preserved or stay preserved, and he kept on thinning only behind. And this also just confirms me that he probably got only one hair transplant by the time on the front here, and he didn't do anything on the rest, like mid-scalp and crown. He was just using fibers.
I do think that that looks like the result of one hair transplant as well, so I agree with Matt on that.
These years on this area, like mid-scalp and crown. This was 2018, and in 2019 there will be another comeback of LeBron's hairline and the whole mid-scalp. You can just take a look at it.
Yo, my boy Slick Nick came through and gave me one of those grade A cuts.
Yeah, I agree. I mean, he's got so much concealer in that picture. It's pretty obvious.
Because I was looking super rough. 2 weeks? I mean, technically like 18 days without a cut. As soon as I got back, I had to sit in that chair, and that boy, woo-wee.
So, you know, he's very open about getting a hair cut. I mean, I wish he was just more open about his transplant journey. I think it would help a lot of people. And that again goes back to my point from many other videos as well, that I wish celebrities were a little bit more open about some of the cosmetic surgeries that they get. I understand, you know, they want to protect their privacy, but it would help a lot of people to know that, you know, he had a transplant or 2 or 3 and what that's done for him, so other people can make an educated decision as well.
Wee! Slick Nick, you a bad mother. Shut your mouth.
It's also quite ironic because this was like September 2019, right? And in October 2019, this incident happened when LeBron James' hair broke the internet. You can see how his teammate Anthony Davis is kind of make him aware of like some hair falling out from LeBron's hairline, and it wasn't like falling out in my opinion. It was just he was overusing so much hair fibers and concealers, and it started to, like, I don't know, spread apart, and it just looked ugly, right? It didn't look good. Losing hair, right? Now, some people think that LeBron was wearing something like this, which you can see here, right? Like a partial hair system or something like that. But I highly doubt that, because that would mean that LeBron had to like be constantly like shaving the whole front for this hair system.
Yeah, in this picture at 7:56, it looks like he's not wearing a lot of concealer. It just looks like he's had, you know, 1 or 2 transplants, and I wish that it was more dense than what it is, but I guess that's how things grew out in his case.
Hair system unit to be like glued on
yeah, I don't think it was a hair system unit.
In order for the partial hair system unit to hold properly, also when the person is sweating, you need to shave that area where you want to like glue that hair system on. So I doubt that LeBron
I agree with Matt on that.
Ever like wearing a hair system, like partial hair system. I think it was just as a result of using hair fibers. Okay, so this was a little shock to his hairline. If you would ask me now how LeBron's hair could look like in reality, I would maybe guess something like this. Okay, if there are like no hair fibers, no concealers in the hair, and we can clearly see here that he also didn't get any scalp micropigmentation done, because then the scalp would look different, would look darkened. Here, I think this is like most like representative condition of his hair after his 1 or multiple hair transplants. We see some thinning areas in the frontal third, we see diffusely thinning areas on the mid-scalp and crown, but very defined hairline. As we can see here, it's clearly an improvement already with his first hair transplant.
The problem is, personally, I don't think he was advised properly on the hair transplant design, especially at the hairline. The problem is it's too low. It's too low in his case, and so a lot of the hairs from the back of the head have been used up on bringing the hairline down and creating something very low. And I know that that's kind of what he theoretically wanted, but the problem is with his pretty advanced recession and thinning, it just doesn't really work for him. And so instead of creating something so low that makes him look like, you know, he's 20 again, which he's not. It would have been nicer to give him a more mature type of look where the sides are not brought down quite as much and where the central hairline starts a little further back. But again, it takes some counseling and it takes some convincing also to tell someone you want a result that's going to be with you for the rest of your life. And now, to me personally, it looks a little bit funny. He's got a little bit of hair down here instead of having good density in an area that's a more kind of mature type of situation that he would be happy with for the rest of his life. Instead, you know, these areas have just had scattered grafts and just doesn't look very natural or great without him having to conceal it.
He was already pretty much lagging almost any definition from his hairline back in 2013 and 14. So this first hair transplant on the hairline already gave him some cosmetic improvement, but again, it wasn't probably something what he was hoping for.
And it kind of goes back to what I've talked about in other videos, where you really want to have like a specific target zone, and the smaller you can create that target zone for the transplant at the recipient area, the more dense it'll appear and the better the overall results. I mean, that's the goal at the end of the day. It's better to have a smaller area that's very dense than like less density just spread around all over the place.
That's why he kept on using concealers and fibers additionally to enhance his appearance, you know, and with the time, unfortunately, also kept on losing more and more hair follicles from the mid-scalp and crown. Also, if we take a look at some recent photos of LeBron James from late 2020, one would think that this guy probably had been pursuing multiple hair transplants since like 2018 and 19.
Yeah, now to me it looks like the frontal hairline is a lot more dense than it used to be. I think he still has some concealer in there. But again, they haven't really even addressed the mid-scalp area just yet with transplants. I think they're just trying to work on the frontal scalp, getting that density up as much as possible. It's still a challenge.
But it's not really true. In fact, it seems like the same hair loss progression is still intact. We can see LeBron diffusely thinning all over his mid-scalp and also vertex. From here, it seems like his crown area is also balding pretty aggressively. Who knows if this guy and how well is he going to be like keeping up.
You can see how his donor area is actually quite small and it's quite narrow, and you know that's not great for future transplants. And it's thinned out, of course, from the transplants he's already had, but his crown is extending pretty far back and he's kind of thin in the lower kind of occipital area, which is like the back of the head, but the lower portion. So his donor area is getting more and more narrow, and as that happens, it's just going to be even harder to produce good results with the transplant, because if you take hair from the back that's sensitive to DHT, that's going to ultimately thin, and you've moved it to the front, well, you're going to lose it then in the front. So it's not about transplanting hair from one area to another, it's about transplanting hair that's resistant to the effects of DHT so that you can maintain that hair for the rest of your life, ideally.
But it's also obvious that LeBron wasn't like the most serious guy about hair loss prevention either over the last decade or so, which is something that he should have considered and he should have paid more serious attention to.
Well, I think we don't really know, right, like what he was doing for prevention. It's an assumption that he wasn't doing anything, but maybe he was. Maybe he was taking finasteride, maybe he was getting PRP, maybe he was doing a low-level laser light cap therapy. He may have been doing a number of things. Rogaine, I mean, yeah, maybe he was, and still sometimes the genetics are just too strong. And you get continued thinning and recession.
That was pretty much it for this video. That was the hair transformation of LeBron James.
Yeah, I think Matt did a nice job. I think the only point where I disagreed with him was on the quantity of grafts for the kind of anterior most frontal hairline, the area that he had circled earlier. I think that procedure, he had fewer grafts, but then ultimately I think he did have probably a total of, I don't know, I'm sure he's had at least 3,000 grafts transplanted, and some of that may have been through the FUT method, and obviously he's had FUE based on those dot scars that we saw earlier. That's kind of hopefully the surgeon's perspective, kind of gave you guys a slightly different way of looking at it, but Yeah, I think Matt and I agree on most of the essential points. There's been a lot of buzz around John Cena's hair. How has his hair changed? Has he had a hair transplant? Let's take a closer look throughout the years. And if you haven't already, please subscribe to my channel. In 2005, at the age of 28, we can see here that John's upper and lower horizontal thirds of the face look proportional. The middle third is his shortest segment. John has a strong brow ridge, which is one of the characteristic features of his face. When we look at his hairline, we can see that there's a central part. And while central parts are fairly rare in men, they of course do occur. The more common directionality of men's hairlines is a fanning type of directional flow. But for many men, it's not a standard fanning type of pattern. You might have one side of your hairline that has a more, let's say, anterior direction, and then another part of the hairline might be moving more towards one side. It's important to observe that natural directionality, especially when we're doing hair transplant surgery, because if you don't mimic the natural flow of one's hair, it won't look like a natural result. And that's one of those elements that makes a high quality hair transplant stand out from the rest. In 2006, at the age of 29, what we see here is that John has strong anterior temporal points, and that helps frame his face. The anterior peak of the temple should not be any more medial than the tail of the eyebrow. That is a great reference point when I'm designing temples for patients. And John's natural hairline is quite straight. In 2007, at the age of 30, what we see here is that the directional split that I was talking about previously at the central hairline occurs only for the first 1 to 2 inches of the hairline. Then further back, it changes to a more anterior facing type of directionality. It is these nuanced features that makes hair transplant surgery both challenging but also exciting to perform. And in 2008, at the age of 31, I want to point out here that his crown hair looks quite strong. Usually when people think of crown thinning, they're most concerned about how that will look from the back of their head. But when you look at the profile of someone's head, that is sometimes the best way to observe the fullness or sometimes lack of hair in the crown area. What you'll see in someone who has a thinner crown is that when you observe the contour of their head, essentially from the front to the back, there will be a drop off of density, and that's pretty clearly seen on profile view. When that crown density is boosted, you'll start to notice a more even contour that then develops. And here are a few of my own patients where you can see that taking place. After the crown hair grows in from the transplant, that nice even contour is reestablished. And that's very clearly seen from the profile view. But in John's case here at the age of 31, I don't see any obvious drop off in his crown area. And in 2009, at the age of 32, I see no further changes, and that's the same through 2014. In 2015, at the age of 38, when we compare back to John at the age of 28, so 10 years prior, we can see some very slight frontotemporal thinning. His hairline is now slightly less straight, and that's why when we design hairlines for patients, especially in their 20s, they're sometimes asking for these very straight hairlines, but we know that that will change with time, and they're going to have at least a minimal degree of recession develop. So we try to mimic that when designing hairlines for patients in their younger years. Sometimes it's not just about giving patients what they ask for, but really looking out for them as far as how they will mature and age with time and making sure they look natural, not just in the moment, but also in the future. And it's interesting to point out that when you look at John Cena's crown in 2015, you can already see some thinning hair. And that's especially obvious when his hair is longer. So even though there's been this recent chatter about his crown hair loss in recent years, when we look back over 10 years ago, we also see this type of crown thinning. Some people only experience crown loss with their hair loss pattern, and sometimes the hairline looks preserved. So that's one of the reasons why I'm not a huge fan of the Norwood-Hamilton scale for especially clinical use. There are many more patterns than just the 7 that are represented in the Norwood scale. In my clinical practice, I see hundreds, if not thousands, of slightly different hair loss patterns. And it's important to point out here that for most men, it's usually in that decade from age 25 to 35 when guys will experience the most aggressive hair loss that they will at any other time in their life. Now, that's not the case for everyone, but that is where most people experience the majority of their hair loss. So for people who care about their hair, that's especially the decade when you want to try your best to prevent further hair loss. And as we've talked about on the channel over the course of many videos over many years, finasteride is going to be your best friend in helping to prevent further hair loss. It of course has some potential for side effects, and we have a video dedicated to just that, but the majority of patients do very well on standard dose finasteride. And when they need to, they can drop down to a lower dose of finasteride and tolerate it extremely well, where they're getting the protection for their hair, but with little to no effect on the rest of their body. And many people these days are finding it very easy to go to feelconfident.com, fill out a questionnaire, and obtain finasteride safely. And I wanted to make sure here that you all know about our newsletter. We send out a newsletter every few weeks that has the latest information on facial plastic surgery and hair restoration. So if you haven't subscribed to the newsletter already, make sure to head to feelconfident.com and do just that so you stay up on the latest information related to these topics. In 2016, at the age of 39, I see no change. And in 2017, at the age of 40, in my opinion, John's crown loss appears stable. The base density here is at about 15 to 40%, depending which part of the crown we're referring to. And remember that we usually start to see some degree of hair loss when at least 50% of the original density has been depleted. And by that point, it becomes very difficult to take the hair from, say, 50% and boost it all the way up to its original density. So it's important to identify hair loss early so you can give yourself the best chance at protecting what you have left. In 2018, at the age of 41, we now see that John Cena is wearing his hair longer. And where he has that central part that we talked about, you can see that there is this illusion of thinner hair in that area. And that's always the case. Anytime you have a part line, it's always going to look like that portion is the thinnest portion because that's where the direction of the hair is changing. And even when we do a hair transplant and we go into that area with more grafts, if we do it naturally and we follow the natural directionality, you still will see a thinner area where the part line is. And that is something that I stress ad nauseum to all of my patients so that they understand that it's not that we didn't put enough hair there in that part line, but rather that that is a natural appearance to anyone's hairline part. And if instead you try to change the natural directionality and place hair in a different way that it is in the vicinity, it will look a lot less natural and it will just look strange. And the naked eye will perceive that something looks off and maybe even fake. In 2019, at the age of 42, I see no change, and that's the same through 2022. In 2023, at the age of 46, this is around the time that a lot of people started to talk about John Cena's hair, and they were concerned about his crown loss, and they were wondering, why he hasn't had it fixed, right? So that was a lot of what was being said online at that time. But to my eye, when we look back at photos of John from, say, 2015, the hair loss looked very similar. It's just that I think with his shorter hairstyles, people didn't exactly pick up on it. And for movies, I think he was combing his hair mostly back and maybe even using some concealer to cover up that crown loss. But then in 2024, at the age of 47, there were two specific times when people really saw John's crown and they started to get I guess, somewhat concerned, or they really just started to, talk about it more. The first was in WrestleMania 40 in April of 2024, and the second incident was on the Kai Cenat live stream in October of 2024. And with this increased attention on his crown thinning, John Cena had the following to say: "Man, I know I got a bald spot on the back of my head. I flossed it at WrestleMania. Me, you, and like 7 out of 10 dudes have them. So I don't care. I'm not perfect. That's not me." So my reaction to that is that embracing our imperfections is a beautiful thing. Look at me. I'm bald and a hair expert at the same time. Life is full of paradoxes and inconsistencies, and that's fine. I was totally cool with John Cena embracing his natural appearance. But then 2025 hit. Maybe John does care about his bald spot after all, but I do think that it's unlikely that he had a hair transplant. Just the timing of it all and the lack of scarring that I'm seeing just makes me feel that it's most likely not a hair transplant. But remember that there are many ways to conceal thinning hair. Some people wear wigs on their head. Sometimes they're called hair pieces. Others use fibers, which is probably the most common way to cover up some areas of thinning. Yet other people get less invasive procedures like scalp micropigmentation. And then of course there are people who just get very creative with their hairstyles and they're able to cover up some of those areas that have thinned. So maybe all the talk about his hair did finally get to John, where he was like, hey, maybe I should do something to cover up the area so people can focus more on my actual movies and on my wrestling and not so much on the thinning of my hair. Celebrities are human beings and they're not immune to public ridicule. And when it's not just a few people writing it in comments, but millions and millions of people saying that, hey, maybe you should address something, or, some popular talk show bringing it up, it gets people thinking that, maybe they should actually address it. But I think it would have been cool if he did nothing. But clearly he wanted to do something about it so that probably fewer people would talk about it. John had the following to say in an interview on March 31st, 2025. "I'm one of those folks in the 7 out of 10 men with thinning hair. I've learned that, hey, you're not at the mercy of the court. You need to keep the hair you have healthy. So now I take care of the follicles I have on my hair because I want them to last as long as they can. I do minoxidil at night. I do red light therapy. I take vitamins. I make sure I'm washing and conditioning with products that strengthen my hair." So now it looks like John is purposefully trying to preserve and strengthen his hair. But as I said earlier, and as I talk about in many of my videos, the only way for men to protect their hair and to keep it from falling out at a high fidelity is with the use of finasteride or dutasteride. There is no equal substitute. Not with minoxidil, not with laser light, not with vitamins, or with any other product. These other options can help thicken your hair, but it will be a losing battle over time because they're not getting at the root mechanism of why the hair is falling out in the first place, which is androgenetic alopecia. That is a hormonal process where you have testosterone being converted to a stronger form of it called dihydrotestosterone. And as that happens, you get the attachment of the DHT, the dihydrotestosterone, to sensitive receptors on the hair follicles themselves. And when that process occurs, you start to get a miniaturization of the existing hair follicles, especially in areas where the follicles are DHT sensitive, which is primarily this central corridor. So the finasteride and the dutasteride are blocking that hormonal process from occurring by reducing the conversion of the testosterone to its stronger, more potent dihydrotestosterone. And when it comes to thickening one's hair, John definitely brought up a few great options, but of course the shampoo and the conditioner that we use is also very important. And maybe we should send John some of our GQ award-winning shampoo and conditioner. These have the key ingredients that it takes to help maintain your hair. But again, the shampoo and conditioner are not a replacement for finasteride. They're simply an adjunct. Today, we're going to be talking about Floyd Mayweather's highlights hair transplant on Instagram video. I'll be doing a reaction to it. And this is posted by hair transplant Joe Tillman, who I think is a hair transplant enthusiast, and it'll be interesting to see what his thoughts are on Floyd Mayweather's recent beard transplant.
Hey everyone, welcome to the Hair Transplant Mentor YouTube channel. My name is Joe Tillman, and if you don't know what a hair transplant mentor is, you can learn all about it at hairtransplantmentor.com.
I don't know what it is. I'll go check that out.
Floyd Mayweather, of all people, has had a hair transplant. And not just any hair transplant, he had a beard hair transplant and, apparently, a scalp hair transplant. Now it's kind of confusing because it's like scalp hair to the beard and then scalp hair to the scalp.
So when we're talking about hair transplants in general, most of the time the donor supply, the source of the hair, like where it's coming from, is coming from the scalp. It's rare that I have to go to other parts of the body to extract out hair. Eventually people run out, so then you're looking for other sources. But it's not uncommon to use the scalp for both feeding the scalp, right, transplanting to the recipient area, which would be the scalp in many cases, and also using some of that hair for the beard. Now, depending on how much hair you need, those can be pretty big procedures, because when I'm looking at here, it looks like it's maybe like an immediate result, maybe the following day, because I'm seeing little scabs, or it could be a week out even. You're seeing still some scabbing, you're seeing some early hair growth. It could be the length of the hair that they actually inserted, or it could be starting to grow a little bit. So I'm seeing the same type of effect on the scalp. But you're looking at a lot of grafts. I mean, to get this much hair for the beard could easily take up like 1,400, probably closer to 1,800 grafts. And then depending, I can't see the full head, depending on how much hair he needed here, you're looking at probably at least another 1,000 if he just did into the frontal area. So that's a lot of grafts. I mean, probably he did a transplant of maybe 2,000, maybe 2,200, up to maybe 2,600 grafts, which I'm sure money is not an issue for him.
Money add then multiply.
But you know, you do have a limited supply, and you don't want to overexhaust that supply, because then it starts to look bald at your donor area. But all those hairs likely came from the back of the head. You can also take from the beard lower down, like in the neck area, and then sometimes for guys I'm taking from the chest and the back as well.
Yeah, I woke up this morning and I saw on, I think it was on Reddit, Floyd Mayweather had a hair transplant. And this is kind of significant, at least in the fact that he's bringing some light onto the subject that a lot of people just don't know about.
Yeah, I think that is good that you have a celebrity, an athlete that's actually talking about, you know, what they do in terms of like hair and also, you know, plastic surgery in general, and not being shy about it. I think it's really good because it kind of normalizes the process. A lot of people feel like they can never look a certain way that they think would make them happy, and they're, you know, embarrassed by it. And it's good to see that, you know, like you have these celebrities talking about it. On the contrary, you have people like Jennifer Lopez that, you know, put up videos and pictures really touting their own skincare line and saying, I've never had Botox in my life, when it's obvious that they've had something done.
Okay, I just took off the mask. Honestly, I cannot even see a line on my face.
So it just makes other people feel worse, like they can never look like her, when in reality, if they do some of the same things that she's done, they probably can. So, just my 2 cents.
With him getting a hair transplant, it brings more light on the subject to where there's a little bit more awareness, which is always a good thing. But the second thing is that not many people know that you can actually have your beard rebuilt using hair transplant methods that are available today.
Yeah, so most hair transplants are done to the scalp, from the scalp to the scalp. But as I said, sometimes I'm doing hair transplants that don't involve putting hair on the head. And so just a few days ago, I did a pubic hair transplant for a young woman. I do many eyebrow hair transplants, beards, all that kind of stuff, because, you know, people want hair in different areas. I have one patient coming up in a few weeks who's actually getting an underarm hair transplant. So he had a procedure that destroyed a lot of the hair under his armpit area. And so now he wants that hair back. You know, there's all types of different hair transplants that are possible.
So with regards to his beard hair transplant, yeah, he doesn't really have the ability to grow a normal beard. And I mean, there's nothing wrong with that, but you look at, you know, a couple photos like these, you can see he's got the goatee, but the hair on the cheeks right through here, it's pretty patchy, pretty scraggly, and just not really a good look for him. So I think it's probably a good idea. Like if he wants to be able to have a beard, why not get a beard transplant? They're becoming more and more popular. But the unfortunate thing is that if you have it done the wrong way, just like with hairline work, it'll look bad and you'll regret it. Now, here's something that's actually playing in his favor. Black hair or African hair is way curlier than Caucasian hair and the typical Caucasian white hair. So it's actually easier to get a good result.
I'll see what else he has to say, but just a comment on that. From a technical standpoint, as the surgeon, I can tell you that the curl that you see on the outside is oftentimes also on the inside underneath the skin surface. And so when you're extracting it, let's say with the FUE method, oftentimes it's a little bit difficult to get that angle right, and so your transection rate is usually higher, or you have to go up on your punch size. So from a technical standpoint, it's more difficult. From the standpoint of creating a look of more density because you have more of a curl, then yes, you have some advantages there. That type of hair tends to be thicker and also curlier, and that does help with like the final appearance, but that's assuming you do a good job with extracting the hair in the first place.
And there's two reasons for that. If we're talking about beards, you don't need to worry so much about angle and direction like you do with straighter hair, because there is no single direction or angle for all the hair to kind of flow into. It's curly, so the angle and direction really isn't important.
It's still helpful when you're at the beard, even for African American hair, to angle it closer to the surface of the actual skin of the face. And so I would still recommend that that be done by your surgeon. But I agree, it's a little bit less critical compared to when you're working with straighter hair.
It doesn't really run the risk of looking unnatural because it goes in different directions. Curly hair is curly hair. But, and I'm not talking about wavy hair, I'm talking curls.
This sometimes comes up as an issue with African American patients who want their eyebrows done, an eyebrow hair transplant. When the hair is really curly, it can be difficult to achieve natural results on the eyebrow. So that's sometimes, you know, a concern. It's not a contraindication to the procedure, but it's just something that people need to be aware of. But things are generally more forgiving in that regard on the beard.
You get better coverage with fewer grafts compared to other ethnic hair types. In other words, one hair from an African patient can be equal in coverage to 3 or 4 hairs, maybe even more. It depends on the curl itself and the caliber, the thickness of the hair. But you basically get more mileage with fewer grafts with African hair.
I agree with that. I agree with that. And so potentially going back to what I said initially with the graft count estimate for what Floyd had, maybe he had even fewer hairs, but I can see all those little marks, all the crust that he has, and it still looks like he had a pretty hefty procedure.
So yeah, I think it's probably going to turn out to be a good result for him, except for one thing, and that's where, if you look in this photo here, this is the photo that set everyone into a spin, but the part that I think looks unnatural is right here under his lower lip. It goes too high. You don't really see this kind of distribution of hair on most men. There might be a few exceptions to the rule.
So I would say, we'll post some pictures up here in front of me. I would say that in some ways it's like an ethnic difference. I think in Caucasian men, you don't see the hair in the kind of goatee area coming up that close to the lower lip, vermilion border. But in certain other ethnicities, including African American, you do sometimes see that. And so that's just an ethnic variant when it comes to the hair pattern. So I don't think that that's an error what he had done. So.
But most men don't grow hair above the crease that's right here below the lower lip. You can see on my own, like I got no problems with my beard. Like it is full. Like I've had doctors like staring at my beard because they're just dreaming about how many grafts they could get for me. So I got no problems with that. But if you look, it's like right here, there's this line that everyone has below their lower lip. And that's usually where hair stops growing. There might be a few scragglies above it, but then you usually have this little central portion here. It doesn't come all the way up to the bottom of your lip like his does. That just looks silly. So this is one of those giveaways, one of those tells that someone has had a beard transplant, and a bad one at that. The clinic just doesn't, they just don't understand it.
I think that's an oversimplified way of looking at it, honestly, because most of this decision making with like where exactly the hair goes is done in concert with the patient, and everything is drawn out in advance. So it's unlikely that the clinic or the surgeon went up to an area where Floyd didn't want hair. So there's probably a reason for why he wanted it there, and I'm sure he's done his research as well. He's a pretty smart guy, so I don't think this was like a grave error.
Let's talk about his hair, like his scalp, his scalp hair transplant back into the scalp. Jesus, that's confusing. Okay, so in this photo, we don't have a lot to go by. We can see kind of like the outline of a hairline shape that's been created, but it's too much of a flat angle. Like we can't see the shape of it itself. What I can see is I can see over here, it looks like a temple point was reconstructed. And while it's difficult to see this angle as well, what I can see tells me that it might have been placed too high on the side of his scalp. They're not supposed to be that high. Like mine's like right here. It comes, like if I draw a line out here, it's just above my eyebrow. I think his is higher up here, which isn't a natural look.
With that temporal extension that Joe is talking about, again, there's a lot of variability there, and from this angle of Floyd's hair, I'm not really seeing that as a major detriment to his overall look. If anything, he has more of an anterior projection than Joe does. His is fairly flat, which is fine. Again, I don't really see any mistakes that were made. I'm sure he went to a good clinic and had it done the right way. And so overall, we'd have to see, different perspectives, different views. It looks like, things overall are fine. And I'm sure he'll grow that hair and most likely be happy.
All we can do is monitor and wait and see. And I'm sure that over the next several months, it'll be easy to do so.
Yeah, so I definitely thank Joe for, kind of shedding some light on Floyd's experience, and it would be amazing to hear from Floyd himself about what it was like and what his decision making was with why he did it and where he did it and how the whole process went. I'm definitely curious to see how it grows out, and I'm sure we'll be seeing him. I know he has that big fight coming up with Logan, right? Logan Paul. We'll see how that goes. Today we'll take a look at Sylvester Stallone and see which facial plastic surgeries he may have had. Stay tuned for costs of the procedures at the end of this video. In 1974, at the age of 28, Sylvester has a Norwood 2 type of male pattern hair loss. He has frontotemporal recession, and you can see here that he has a very strong masculine nose as well as a very good strong chin. In 1976, at the age of 30, I can appreciate here the asymmetry in his brows. The right side is higher up than the left, and he also has his entire right orbit of the eye is sitting higher than the left. It's very common. He also has congenital ptosis, which is different from having excessive upper eyelid skin that we call dermatochalasis. In his case, it appears that he has upper eyelid ptosis. I also think that Sylvester has a very characteristic mature look, partly because of the lateral canthus of the eye being lower than the medial canthus of the eye. In 1977, at the age of 31, what I'm appreciating in these images is congenital unilateral lower lip palsy. That's weakness of one side of the lower lip. In his case, it's weakness of the left side, meaning that the left depressor labii inferioris muscle on the left-hand side is not contracting at the same strength as the right side. The way that this is treated when patients want it addressed is to then weaken the healthy depressor labii inferioris, in this case his right side, so that it doesn't pull as much. And you can see this throughout the years in many different images, this type of difference, and it, again, gives them a very characteristic lower third of the face. In 1978, at the age of 32, I'm not seeing any changes. In 1979, at the age of 33, what I appreciate here is just the naturalness of his nose. It's very well balanced with the rest of his face, and he has this very impressive lateral red lip eversion. Some patients come to me asking for like a corner lip lift. In this case, this is someone who absolutely would not qualify because he already has very nice eversion on the lateral aspect of his upper lip. In 1980, at the age of 34, I'm not seeing any changes. 1981, at the age of 35, it appears that Sylvester goes through some weight loss and his jawline is just looking a lot more chiseled because of that. He does have more prominent forehead wrinkles, and that's partly due to the lifting of the brows because of his underlying ptosis. In 1982, at the age of 36, the weight loss has definitely created better jawline definition, but it has also led to some mid-face volume loss, and that appears to be addressed later on. From the age of 37 in 1983 to the age of 50 in 1996, I'm not appreciating any changes in Sylvester Stallone's face as far as facial plastic procedures are concerned. In 1997, at the age of 51, it looks to me like Sylvester Stallone has had a facelift and fat transfer performed to the face. What I'm appreciating is the blunting of the intertragal notch. And you can see in this image that we're putting up on the screen, just below the tragus is this very specific area called the intertragal notch. And depending on how incisions are designed for facelift surgery, sometimes that notch can be blunted. And that is a giveaway for plastic surgery. Also, it looks like he may have had his upper eyelid ptosis repaired, or at least partially repaired, and that's what I'm appreciating in these images. In 1998, at the age of 52, there are no noticeable changes. Same in 1999 at the age of 53. In 2000, at the age of 54, what I'm seeing are some signs of a hair transplant. In this case, what I think happened was an FUT procedure, partly because of the year. In 2000, FUE really wasn't being done. So FUT is the most likely method that he had, and it looks like he had maybe about 1,000 to 1,200 grafts just to strengthen and slightly lower the hairline, particularly laterally in the frontotemporal zone. FUT is follicular unit transplantation, and it involves removing a strip of scalp tissue from the back of the head, then breaking it up into all the separate grafts under the microscope and transplanting them typically to the front of the scalp. The back is then closed with either staples or sutures. In my practice, I prefer using sutures. Those sutures are then removed 10 to 14 days after surgery, and what results in the back is a linear scar that is ideally a thin scar, but sometimes you can't completely anticipate what that scarring will look like. At the age of 55 in 2001, what I'm noticing are those heavy grafts at the hairline from the hair transplant. It looks like fewer single hair grafts were transplanted to the hairline, and that gives a bit of a heavy sense at the hairline and reduces its naturalness. In 2002, at the age of 56, what I'm seeing are signs of a surgical hairline advancement coupled with a brow lift. Now, this is an interesting combination, and the reason this is a popular combination to employ is because you're already making an incision right at the hairline, and using that incision, you can both lower somebody's hairline and you can also raise the eyebrows, since you can work through that same incision. A surgical hairline advancement is not commonly performed in men, especially younger men. However, in older men with a stable hairline and overall hair features, it can be a useful modality to bring down good density lower down on the forehead if that's desired. And the reason why I think I see signs of a surgical hairline advancement as early as 2002 is that as we go on and we look at additional images later on, you'll start to appreciate the scar at the hairline. This type of scar is not something that we see with a regular hair transplant. In 2003, at the age of 57, I'm not seeing any changes. Same in 2004. In 2005, what I can appreciate in this image on his left-hand side, his left ear, you can really see the facelift scar quite visible in this image, but I don't think he's had any additional surgeries. Age 60, no change. Age 61 and 62 and 63, no changes. In 2010, at the age of 64, what I'm noticing is, again, the lack of tragal outline. If you look at his right ear here, especially focusing on the tragus, this little piece right here, from his original facelift, it's really obliterated the tragal outline. 2011 and 2012 and 2013, no significant changes. 2014, also age 68, no major change. 2015, 2016, 17, 18, 19, 20, 21, still no change. In 2022, what I'm seeing here quite clearly to me is that surgical hairline advancement scar that is quite visible as his skin has gotten a bit darker, whether from sun or some other coloring. He has maintained this lighter, paler scar from the surgical hairline advancement, and that is visible here. But I don't think at the age of 76 that he's had any additional procedures. So on the high end, the total of all these procedures is $150,000. Let's go over different stages of hair loss that The Rock and many other men around the world experience. We will talk about possible hair loss treatment solutions at each hair loss stage. Before we get into this, let me just say that The Rock is one of my favorite celebrities. He's allowed me and many others to accept our hair loss, and also just gives us so much inspiration throughout all the different elements of what he does. So I just want to say thank you to The Rock, and go watch Black Adam. So here we have the Norwood scale. Now note that there are variations of male pattern hair loss, and it doesn't always have to follow this exact type of pattern. But in general, you have this type of recession that occurs at the frontotemporal angles. As that starts to creep back, you go from a Norwood 1, 2 to a 3, and then you start to develop some crown loss. And that crown loss usually starts off small and then expands over time. And eventually, the crown and the frontal loss begins to fuse. And that's when you get more into the Norwood 6 and 7. And at the end of it all, you have that kind of moon shape, horseshoe shape appearance of the hair left behind. Now in 1987, at the age of 15, you can see that The Rock actually looks older than how I look now, which is incredible. You can see that his temple hair is medialized and it's aligned nicely with the tail of the brow on both sides. He has a strong hairline in this image, and it's proportional to his mid-face and his lower face. And he has no signs of hair loss at age 15, so he's a Norwood 0 technically here. In 1994, at the age of 22, this is now 7 years later, and his hairline position has shifted up, and the frontotemporal recession is now present. So here it looks like he's a Norwood 1. Now, restoration options for people in a similar situation could be first-line medical therapy. First-line medical therapy is essentially finasteride and minoxidil. Some people do that both as a topical formulation. We personally prefer it as an oral formulation for better efficacy. Each of those has its own set of side effects, and I encourage you to watch our videos on finasteride and minoxidil to get a full sense of the pros and cons of those medications. But when I think of medical therapy for hair restoration, that is the first line for men. Alternative options for someone in this position would be PRP treatments, which is platelet-rich plasma. Again, we have videos on each of these topics. Low-level laser light therapy, or microneedling, or even nutraceuticals such as Nutrafol and Viviscal. These are not replacements for the minoxidil and finasteride, but for people who can't tolerate one or the other, they should consider these alternative options. Now, if someone came to me with this type of presentation that we're seeing here, I would not offer them a hair transplant, partly due to age, much too young at age 22 with this degree of loss, which is not much, and there's an uncertainty to the ultimate pattern of the hair loss. So I would tell someone like this to just wait it out, be on some medical therapy if the hair loss bothers them and if they're trying to prevent further loss over time, but not to jump into a hair transplant. In the year 2000, at the age of 28, this is now 6 years later, you can see that the corners have started to push back even more, and the anterior temporal peak has also started to recess to a degree. So at this stage, The Rock is a Norwood 2. And again, medical therapy is an important option for patients who are trying to prevent further loss and to stabilize their current situation. Now, if someone is stable on medical therapy, in a situation like this, a Norwood 2, we could consider a conservative hair transplant to strengthen both the temples as well as potentially the corners. So this type of procedure usually can consume anywhere from 800 to 1200 grafts, whether it's done with FUE or FUT. And again, it depends on the person's goal, how much lowering they're looking to have. I never recommend anyone go back to a completely straight line across. It's not really a good solution for the future because of the risk of further recession. Now in 2006, at the age of 34, another 6 years have passed, and there is a preservation of the frontal forelock that The Rock has, and further corner recession. He's heading towards a Norwood 3 at this stage. Patients in their 20s to 30s experience the most rapid degree of hair loss, usually late 20s to early 30s. So right where The Rock is here at age 34 is when most of that rapid loss occurs. So it's a time when guys are starting to really be bothered by their hair loss and sometimes even getting a little desperate for a solution. But it's also a time that we have to be careful with the type of hair transplant that we offer. If it's overly aggressive and there's no medical therapy on board, that could spell trouble in the future for how the hair ultimately looks. So when people come to me for hair transplant, I'm thinking about like long term, not just the next few years, but how are they going to react to their hair appearance in like 10, 15, 20 years from now? If we do a surgery now, will they regret it in the future, or will they be much better off for it down the road? So that factors into my decision making. Please make sure to subscribe to the channel and turn on all notifications. We post new videos every Wednesday and Sunday at noon. Thanks so much. In 2009, at the age of 37, now The Rock is clearly at a Norwood 3 stage. And we tried to figure out what the situation is with his crown at around this time and looked for different pictures. And as far as I can tell from like this profile picture, I'm not really seeing any obvious signs of hair loss at the crown. The Rock has spoken to his decision to shave his head in the past, and he has said that it wasn't so much that he was losing hair, but he just didn't, I guess, like the consistency of his hair and decided that it was going to be better to just shave it completely. I would argue that there are definitely some signs of progressive hair loss that I think he was experiencing up until, this 2009 year. With the following year, 2010, he decided to buzz his head, but it looks like further back at his crown was pretty solid. So I think if he had stabilized with medical therapy, he actually would have been a decent candidate for a hair transplant, if that's even something he wanted back at that time. Also, around 2009, 2010 was when FUE was becoming more popular as a harvesting method. So I think that would have worked reasonably well for The Rock at that time if he wanted to go down that path. Of course, as we know, he did not. And so in 2010, he decided to shave his head and go bald. And it appears in some of these later images, like age 38 here, that the frontal forelock is starting to thin to a degree compared to prior. And even if he had opted to restore his hair with a hair transplant, medical therapy would have still been very important because he had a lot of hair left, and we would have wanted to preserve that hair and augment it, build on top of it with the hair transplant. And if we're doing a hair transplant in a situation like this, like what he looks like here at age 38, we wouldn't want to overfill the area, especially an area that's already dense. Now, I see some people on our videos or on other videos commenting that
if you do anything less than 2,000 grafts, it's just a waste of time.
And that's just simply not true. It depends on the size of the recipient area that you're looking to fill. There are two concepts here. One is trying to avoid shock loss, both in the donor and the recipient area. If you overcrowd an area with hair, you can potentially lead to something called shock loss, where the hair basically just mostly temporarily dies off, but sometimes that can be more permanent. So that could happen both in the back and in the front. So you don't want to over harvest, and you also don't want to implant a ton of hair into a smallish kind of area. Now, the other concept here is density disparity. If you're doing a hair transplant where you're improving the frontal forelock, but there already is hair there, you're basically doubling down on an area that has hair. So you're going to bump that up to maybe an overall percentage density of the original of maybe 80%, 90% density. Meanwhile, if you're putting hair into an area that has no hair at the moment, like essentially the corners that have recessed, there's nothing there. So there are limits to how dense you can get with a single transplant. And that's something that's very important to remember. Those corners can get to maybe about a 60% density if everything goes well. You will never get to 100% of the original two-dimensional density when you're doing one single transplant into an area that's completely bare. So in order to bump up that density, that will require additional surgeries down the road. And so that is a concept that I'm trying to stress more and more during my consultations with patients so that they have realistic expectations. Now, another thought here for The Rock, if he was interested at that time, would have been scalp micropigmentation. Now that would have been an option here for that kind of stubbly improvement with a two-dimensional type of result, but something that can look very natural if the hair is kept short. We did a video on SMP, make sure to check that out. In 2012, at the age of 40, The Rock looks great bald. I have to say that. It looks really good on him. And he's starting to sport more beards and goatees, which is very common for people who have started to shave their head and they want to draw attention sometimes away from that area. So they look to have some facial hair. And it definitely takes the eye off. And then over time, there is like more of a self-acceptance and people are more comfortable shaving their beards and just kind of rocking the bald look and being fully content with that. But I would argue that there is a transition that occurs there when people first start to go bald. In 2016, at the age of 44, you can see that The Rock has dropped the facial hair and you can really see that awesome smile opening up on him. And it's hard to tell now where on the Norwood scale The Rock is, since he actually claims that he shaves his head every 36 hours to maintain the appearance that he has. Could he have progressed further than where he was with that Norwood 3 situation? Or, maybe he maintained that, but you just can't tell because of the frequent shaving. In 2022, now at the age of 50, let's assume that The Rock is at a Norwood 6 or 7. And he only has, let's say, that horseshoe left if he weren't shaving. What would his options be? And what would the options be for anyone in a similar situation? So number one is, of course, to do nothing. Many people accept the fact that they have lost their hair and they're not looking to change what naturally occurs, and that is totally fine. And so you can do nothing, and that is great. If people have accepted themselves with that kind of horseshoe moon-shaped type of hair appearance, then great. Another option is to keep shaving it, right? And that's what The Rock does to maintain it. Some people can even get electrolysis, laser hair removal to reduce the need to shave as frequently. But then again, if you one day want to not shave and have your hair and grow the hair back, you're going to be limited in your options because if you did the laser hair removal, it burns those follicles out. Another option would be a wig or a hair system, and there have been plenty of celebrities and plenty of people who go down that route. And of course, that can bring a lot more hair into the picture, but there's always this thought of like, well, you're walking around and that you're kind of tricking people, and not everyone enjoys that. And also the fear of going into the water and having it come off, or having someone notice that you're fooling them, or whatever the thought process is. But it's not for everyone. But there are some people who get amazing hair results with just wearing this type of hair system that they have to change out every few weeks or so, and it works for some. Another option is scalp micropigmentation. So plenty of guys who end up going bald, they want to have the appearance of like something still there. So they get the scalp micropigmentation, which is a temporary tattooing that I mentioned prior, and that can give off the illusion of still having some hair, though it's kind of worn short, or it gives the appearance of having that really short hair. And then lastly, of course, is the potential for a hair transplant. Now, it depends on what your donor density is, and if the donor is adequate enough to replenish that recipient area. Some people have very wide recipient areas when they're completely bald. Other people have a pretty narrow area and a broad donor. So a lot of it is trying to see what they have left and where they're looking to get that restoration. And occasionally we consider some body hair transplant as well, where we can take hair from the neck and the chest to supplement the hair on the scalp. if needed. So what I recommend in the practice is usually sticking to the frontal scalp, frontal, maybe some mid-scalp area first, designing the hairline in a very conservative way so that it's not going too low, because you'll never be able to chase that back when the whole recipient area is bare. So staying conservative, focusing on a specific area, mainly prioritizing the front before we go further back, doing a surgery like that, and then coming back in the future, maybe doubling down on some of that density and also starting to build up further back. Now, as you guys know, I have alopecia areata universalis, and it took me some time to accept my own bald look. And honestly, I am very content with it now. And I'm sure The Rock had a similar type of acceptance that he went through, and he went through it in a very public way, similar to the way I went through it, though of course my audience is much smaller than his. But I just want to say, for people in our type of situation, that you can do it. If you don't want to go down the road of restoring your hair, I think then it's good to work on yourself, your mental abilities to accept the bald look and to learn to live with it and move on, and to exude confidence and positivity. And obviously, The Rock has had one of the most successful careers ever. I just wanted to end with that, and again to thank The Rock for being such a positive figure and such an inspiration to myself and to many others around the world. So today's reaction video is going to be based off of a video by More Plates, More Dates. A guy named Derek has a pretty cool channel. And I put out a video that was called "I Was Wrong About Logan Paul's Hair Loss Reversal." And towards the end of the video, he actually says, he doesn't know much about hair transplants, and he's trying to figure out, did Logan Paul have a hair transplant, or how did he get his hair to be better and more full and that sort of thing. Let's watch the video together, and I'll make some comments along the way.
Fat and bald.
Just take one trip to Turkey, you'll be good.
We might go to Turkey.
I'll come with you guys.
Yeah.
So right off the bat, they're talking about going to Turkey. I'm assuming they're referencing, hair transplants and how that gets done in Turkey. People definitely travel for hair transplants. Some will go to Turkey, some will go to India as another big center, South America, if they're trying to basically find a cheaper type of hair transplant. They basically charge less per graft and for the whole procedure in some of these other countries compared to here in the States. There are some very good clinics in those other countries, but you have to be very careful. Sometimes the hygiene standards are different. If something goes wrong, what are you going to do that now you're back, in the States and you have an issue? So you just have to be careful, and also it's hard to know exactly which clinic is best, because you can do all the research you want online, but if one place is marketing things better than another, then you might get drawn to the wrong place. And so just have to be careful with traveling out for any kind of plastic surgery, but especially hair transplant.
You don't need to go to Turkey to get a haircut. You could just do it in LA. I know people.
What's up, guys? Derek, moreplates.com. Today we're going to be talking about Logan Paul again and his hair transformation. So I did a video a while back in May called "How Logan Paul Reversed His Hair Loss," and basically I talked about how over the span of a couple of years he went from what appeared to be, to me, well on his way to being like his dad. Like you see here, his dad is very, thinned and receded to the point where you would just call him straight up bald.
The dad definitely looks bald right now. There's a classification system when you're talking about hair loss, the Norwood-Hamilton classification system. So his father would be at one extreme, Norwood 7 of that spectrum. Logan, in at least this picture, it's hard to tell because he's got this hairstyle where it kind of falls forward, and so you can't really judge the hairline well. So maybe they'll have some other photos of him during this video, and we'll be able to kind of give a better assessment of what's going on.
Logan, as a young guy, you can already see significant recession and thinning even in his very early vlogs, where you'd be like, this guy is 100% fucked and is going to need to be shaving it pretty damn soon.
Couple of thoughts on that. Some people do recede and thin out earlier, in their lives. But what happens in many people is that the hair loss that you get eventually will stabilize for the majority of people. And that can happen it can stabilize for 5 years, for 10 years. So just because you're thinning at an early age and receding doesn't mean that you're on your way to shaving your head, the following year. What Derek is saying, you just have to kind of keep in mind that there is a more kind of scientific basis for some of this, and just really natural history of hair loss is a little bit different in the majority of people.
Logan had some very obvious shots where the recession was getting severe and the hair loss was getting really bad, and then at the start of his podcast, his hair was, pretty, wispy, thin, etc. And over the span of the podcast, his hair density sort of evolved. So, it was always, he's always talked about his receding hairline before too. Like, he's very open about it.
And I actually really love that Logan's so open about the recession and sort of the changes with his hair. Recently did a podcast with the fabulous Lauryn Hill, and in that podcast we talk about how a lot of celebrities, they're hiding the fact that they get different procedures and surgeries done. So it's nice to see that some celebrities are very open about their situation. I think it helps sort of the rest of us, the rest of, everyone else, people who just happen to have these same issues, to kind of cope with them and see that there are things that they can do to make it better. So I applaud Logan Paul and Derek for bringing that out about his willingness to share.
He's self-deprecating in that regard, and he's even done like the cornrows thing before.
So I don't know if this cornrows hairstyle is something that he wore for a short period of time or a prolonged period of time, but you have to be careful with these tight kind of hairstyles. They can actually promote further hair loss because of the inflammation that's caused. If you have a hair follicle and you have a strand of hair and you're pulling on that strand, you develop inflammation at the root of that follicle, and then ultimately if it's stressed enough, it tends to fall out. So it's just something I don't think he wears this hairstyle much, but for sort of everyone else out there, tighter hairstyles can promote further hair loss.
Said how he looks like a thumb when he pulls his hair back and he like shows the how receded and thin he is.
No, I look like a girl. No. No. Oh, this makes me nervous. Last time I did this, I did cornrows, and I look like a thumb. I look like a fucking thumb. No.
Yeah. So he's pretty okay with talking about it, I guess. And then throughout the podcast, his hair was still like maintaining that thin, wispy look. It was like down and styled over to hide his, recession and his thinning. But it turns out it may have also been, well, it's not like he ever doesn't style it like that.
I do see what Derek is talking about in that the hair appears more full in this shot here at 237. It is his hairstyle to kind of wear it down. And so it's hard to tell, how much intervention he had, whether surgical or non-surgical, to get to this look. I mean, the hair color is different. The hair can appear more full sometimes, even with changing your shampoo, things like that are sort of more natural and are in pharmacologic or surgical interventions. So it's not like a dead giveaway just looking at his hair in this frame. Keep in mind that if the hairstyle were different, we might be able to learn a little bit more about what may have created this fuller look.
Thin, wispy to slightly denser until like in the peak of the podcast, it just had like much better density. And a lot of people commented and were basically saying, no, he didn't. My assessment was, I thought he got on a hair loss prevention regimen, like a significant one, like minoxidil plus finasteride, or like when I say significant, like significant for a newbie, that was a pretty significant regimen. And I thought he probably got on it, was sort of like past the minoxidil shed maybe at the start of his podcast, and then you started seeing the manifestation of the results.
In terms of minoxidil causing shedding, it's only 15% of patients who will experience shedding, so it's not that everyone who starts minoxidil or Rogaine, as the brand name is, it's not that everyone's going to have this type of shedding from that agent, so just keep that in mind. And he's bringing up some other medications such as finasteride or Propecia, as it's otherwise called, and that is a pill you take once a day. The minoxidil is a solution, basically either foam or kind of liquid solution that you apply onto your scalp once or twice a day. I find that in general, most of my patients are much happier with Propecia finasteride in terms of results compared to the Rogaine or minoxidil. They just see improved benefit and better hair quality and reduced shed with the finasteride.
The results later in the podcast, because again, remember, this is him way back years ago, like far, like early 20s. He's like 25 now. This was like 21 years old or something. And his hair looks like this. Like you could tell he's like ready to shave it off, bro, in like a year or two. And then his hair, he would have this frizzy look to kind of hide it. And then throughout the podcast, like I said, he dyed it blonde. The transition was like seamless and so drastic to me. Like it went from like brown to like blonde to like dirty brown blonde with way more density over the span of the podcast.
Aside from the medications that can improve the density, that's on one end, right? You've got the pills and the topicals. On the other extreme, you have surgery and what that can achieve. And then somewhere in between, there are a few other options. The main one being PRP, platelet-rich plasma. I have a number of videos out on PRP and how it's used and what the purpose of it is. And I was on the Dr. Oz show talking about needleless delivery of PRP, but basically taking your own platelets that have growth factors and infusing it into the scalp. So he may have had PRP sessions, and that may also create, fullness, and some people respond really, really well. It almost looks like a transplant result. The biggest difference is that compared to a transplant is that it's transient. You have to keep getting those treatments, but I'm sure he has the funds, and the resources to get those types of treatments. The other type of class of hair loss treatment is laser light therapy. Low-level laser light therapy in the form of a cap like Capillus. There are other companies out there that have these caps, and they provide some degree of improvement. It's been studied. We've got data to support the use of that type of technology to stimulate the hair and also improve the thickness. But you just have to remember that in order to improve the hair when it comes to the thickness of it and just kind of improving its look, with medical therapies, including PRP, you have to have actual strands of hair in that location. Where you no longer have hair, like where it's completely bald, you need a transplant if someone's a candidate for a hair transplant in order to give you hair in that location. So if you were to look at those images that Derek had up on the screen, but with Logan lifting up his hair, then we can really tell if it was a transplant or if it wasn't. Because if in those recessed areas there's still absolutely no hair, it's very unlikely that he had a transplant. Most transplant surgeons and most patients would want to fill that in at least partially. Whereas if it's just increased fullness and it just looks fuller, you just don't know if it was a transplant or not.
My assessment was he probably did a prevention regimen, because frankly, I don't know a lot about transplants, and I didn't think it was possible for him to have, he records every week. He literally would have had to have a transplant in the middle of the podcast recording without anybody ever noticing, and just had it grow in perfectly and have no one know the wiser. I assumed it would be somewhat obvious in some aspect.
This is kind of a loaded point, right? Can you have a hair transplant and go right back to work and not have anyone notice? I mean, that's really the question that Derek's posing here. The answer is yes, for the most part, meaning that, of course, when you do the transplant, you're going to have some swelling because of all the manipulation that's done to the scalp. That swelling over the course of about 3 to 4 days tends to descend down onto the forehead. There are things you can do with the transplant, like putting some steroid into the solution mix that you use to anesthetize this area, giving a patient oral steroid in order to reduce that type of swelling. But once that swelling is gone, there are ways to do a hair transplant without anyone really knowing what had happened. I have a video that talks about the different ways to extract hair for a hair transplant and the different ways of actually putting the hair in. And so depending on the type of method that's used, it's very possible to go back and do a podcast a couple of days later and look like nothing happened, especially if you have a hairstyle that's combed down. Because imagine he received some, hairs from the back into this area where he was receding. Now he's got his existing hairs. They can cover up the area of usually the stubby hairs that are placed with a hair transplant. There's also a method called long hair preview, FUE, which is a way to extract hairs in a long form and move them while they're still long. That's not the most common way of doing FUE or follicular unit extraction, but that is one way to do it, and then you literally look like you just have, your long hairs still there. But there are several methods in which you can basically, go about your business a couple days after hair transplant surgery, and no one really knows, what happened. So I definitely would encourage you guys to watch that other video of mine, and that gives you a lot more information about how the hair is extracted and how it's placed, and ways of basically masking that you ever had anything done.
I might have been wrong. And in fact, he might have actually had a hair transplant somewhere in 2018, 2019 area, that, transition phase between him at the start of the podcast to now, where his hair has way more density. I think he got a transplant done. The reason being is because on the most recent episode, he literally implies that he knows guys who do transplants, and he'll hook up Mike Malak with a good transplant doctor, essentially.
Keep in mind that I'm a hair transplant surgeon, but I do offer non-surgical options, and not every patient wants to go through a hair transplant. So even if he knows hair transplant doctors, he may have gone to one to do non-surgical types of therapies like the PRP, or, you know, receive the regimen for non-surgical improvement for his hair. So that's all possible. But of course, I agree here that the biggest elephant in the room is, you know, did he have, you know, hair transplant? I could tell you more if we were able to see the actual hairline as opposed to just hair coming down. Still hard to tell.
He's pretty transparent in that he doesn't seem to give a fuck when he talks about, you know, his hair loss is this, is that. He literally has like, talks about, you know, sexual shit like all the time. He talks about Viagra, Cialis, etc. Well, partially because a company that makes it sponsors his channel, but I mean, like, he's pretty open about shit and like pretty transparent. So like maybe he's not gonna cover the specifics of I got a transplant, but like it's sort of implied. And frankly, I think that being like reasonably good friends with Machine Gun Kelly, who had one of the most drastic...
Yeah, so let's pause it here at 6:04. And this is, you know, a clear example of a hair transplant. The reason is, if you're looking at the hairline itself, it takes on a whole different shape now, right? So those temporal recessions on Machine Gun Kelly have been brought down. The entire height of the forehead has come down. The hairline has come down. And Logan Paul, at least as far as the types of pictures of himself that are out there, or that the way he wears the hairstyle, it's just really hard to tell.
They're all like, you know, connected. And with Machine Gun Kelly, in my opinion, is probably the same doctor who's, you know, doing all these celebrity hair transplants. And I don't think it's a coincidence that Logan Paul's density is like way fucking better. Like, yes, I've showed some hyper responders on my channel that did it with just medication, but a lot of these influencers, you know, they're gonna go like the Botox route, the hair transplant route, the physical surgery route, because they don't understand pharmacology, nor do they have somebody assisting them to learn about it.
You know, the comment there, you know, I just kind of wanted to elaborate a little bit on. So not understanding the pharmacology has nothing to do with what a hair transplant can achieve. You can take all the medications in the world, that doesn't mean you're going to get the result of a transplant. It also doesn't mean that everybody is a surgical candidate. Like I said previously, if you don't have hair in an area and you want to put hair there, it's not going to grow with any medication. You need a transplant. If, however, you're sort of diffusely thin, especially potentially also thin in the donor area, not a good candidate for a transplant, because where are you going to put the hair? If you put the hair sort of everywhere, then you get this diffuse effect, and it's not very significant, not very impressive. You really want to concentrate your effort when it comes to a hair transplant into, you know, areas where you can really make a difference. You know, I don't really agree with his point here that they don't really understand pharmacology, so they just go get a hair transplant. Not true. Plus, I'm assuming that they're going to, you know, well-regarded doctors, I would hope, whether it's LA or wherever it is. Those doctors won't just do surgery just because they have a celebrity in front of them and who wants surgery, right? So as a surgeon, we have certain criteria that people have to meet prior to getting surgery.
Like, it just seems like cosmetic surgery is like the instant fix, most aggressive thing that's gonna get the best bang for the buck, and and it's like, yeah, you can't really argue with hair transplants. They fucking work.
And also, when you think about the amount of time that it takes for a hair transplant to actually show its results, it's a long time. So it's not very instant. In general terms, it takes about 3 to 6 months after a hair transplant to start to see the hairs growing in. And then you have to wait at least 10 months, a year for the hair to reach some reasonable length and for all the hairs to come in. So it takes about a year to see what you have. So it's not instant.
Probably had a transplant, you know, the transplant doctor probably advised that he take finasteride and or minoxidil as well, probably.
Good point here that Derek makes, because you can do a transplant, but the person will continue to lose their native hairs. The pre-existing hairs in the area that's at risk, they'll continue to thin out and potentially fall out. So it's very important to put people on maintenance therapy with something other than just doing a transplant. So yes, it's true that I advise my patients oftentimes to, you know, be on a medication in addition to getting the surgery, to really try to optimize their results for as long as possible and preserve the hairs that they have, so we don't have to keep doing surgery.
It might be a combination of everything, but to me it was just interesting how his hair basically transitioned throughout the podcast with nobody noticing. That he basically got in my opinion, I speculate he got a transplant done literally in the middle of filming without anyone noticing. So anyways, maybe the FUE procedures are that good now that you can just get it transplanted underneath your fucking hair and like nobody notices.
Yes. That is possible.
On a week-to-week basis, even though you just got it done and he covered it up nicely. But to me, I can't see any other way it would have worked. Any of the transplant experts, you know, drop in here. Like, I'm the pharmacology guy. I'm the guy who's like preventative as well as like aggressive recovery with pharmacology, but like actual surgery, I don't know a fucking lot about hair transplants.
See, that's where I come in. This is perfect. This is a segue to this whole reaction video. My summary is that he may have had a transplant. We don't know for sure. There are other things out there like the PRP, like some of these medications that can create a really full look as long as you maintain it. That's the biggest difference. With surgery, but when your hair grows in, by the time that grows in, you're pretty much set unless you start to lose some of those original hairs that you had. With the medical therapies, including PRP and laser light therapy, you need to continue to do those treatments or else you'll lose the effect. That's the biggest difference between medical therapy and surgery.
So anybody who can assist in understanding if this is feasible to do when you are filming like twice a week for a podcast that literally hits you at a million different angles for like an hour and a half straight, like, is that an easy thing to hide with FUE nowadays, or what's the fucking deal? But anyway, it seems like to me...
Another point here, and again, my other video goes into a lot more depth about FUE specifically, but keep in mind that even though FUT is a lot less popular these days, that actually, an FUT, just in case people don't know, is actually cutting out a strip of your scalp from the back, cutting it up into each of the grafts under the microscope, and then putting the hairs in, as opposed to FUE where we take out one graft at a time. So with the FUT procedure, guys actually, and women, but you know, since we're talking about Logan Paul, let's stick to guys for now. Guys were able to return back to work within a couple of days and no one knew that anything was done. Nowadays with FUE, because the reason is you can leave the hair in the back long, you just cut out an area. So you'll have sutures, but you'll have your other hair covering it up. The downside being that ultimately you get this long scar. So if you ever want to wear your hair short, it's kind of an unsightly appearance. But with the FUE, a lot of times people are doing a shave where they're shaving the back, and there are ways of doing FUE without shave, and that's what that other video talks about. But that actually creates, when you're shaving the area, it makes it harder for people to hide that they had anything done with FUE. People like to poo-poo FUT, but it still has a place in sort of the armamentarium of what we offer as hair transplant surgeons. I think Derek did a nice job of discussing Logan Paul's hair changes. We still, you know, don't have a final verdict on this. I do think it's possible that he had a hair transplant, but not 100%. If you showed me the hairline up close before and after, I could pretty much tell you, but because of the hairstyle, we just don't know for sure. Hey guys, Dr. Gary here. So some of you know KSI, who's a British YouTuber.
Yo, what's up, your boy KSI, the gym!
Rapper. He has done like some boxing. Logan Paul.
From the United Kingdom, the Nightmare.
He has a high hairline, he's been losing some beard hair, and then he put out a video saying, well, I'd like a beard hair transplant potentially. So watch till the end of the video for my special offer for KSI. But let's take a look at what's going on with his scalp and with his beard, and I'll give you some thoughts as a hair transplant surgeon. So I have a bunch of his images here that my video editor Marco put together, and I've got KSI here with his bandana on, which, you know, some people wear to kind of cover up some receding hairline or a high hairline. You know, as you guys know, a lot of times I'm wearing my caps because I have alopecia areata, but today we're capless. And I see another image here of KSI with his bandana off, and yeah, he does have a high hairline. Ideally, so some people focus on the numbers, like how many centimeters of forehead should you have, or should the top be proportional with like the middle third of your face and the lower third. There are different ways to figure out where the hairline should start. But the best way is, and I've talked about this in some of my other videos, but basically if you take your hand and you kind of take a vertical off of your forehead, and then you take your hand again, you take a horizontal off of your top of your head, and where those two points meet is pretty much where you want your hairline to sit, somewhere within that vicinity. So when I'm looking at KSI's here, to me it looks like it's probably about an inch or so behind where it quote unquote should be for ideal aesthetics. And I'm trying to see if there's a picture of the sides. He does have some recession kind of in the temporal areas as well. And so this is a gentleman who is a candidate for hairline lowering, and I have a video specifically on hairline lowering. There are two general ways to do it. One is surgical hairline advancement, and you can see there's a great example on my website of that. We'll put that up. And it's basically shortening the forehead skin by cutting out a portion of the upper forehead skin. So that's done through a series of steps. It's an actual surgery in the operating room that requires some anesthesia, and basically a big cut is made at the hairline and it's advanced back underneath the scalp, and then we bring that scalp down to the new location. And depending on the scalp laxity, you can get anywhere from 2 centimeters up to like 4 centimeters of movement down. And so that's really nice because it's kind of an instant result. You get the thickness of your hairline, the same density as the hairline brought down. That's definitely an option for some patients. The other option is to do hair transplant, where you're taking hair from the back of the head and putting it into the new location. So both of those are possibilities. I think for KSI, I think that you have to think about the number of grafts needed. So if he wants, and I have a video here that was sent to me of KSI asking for advice about his beard.
My beard's just so clout, didn't it? I just got some dead ass beard.
Yeah, he's got a patchy beard. And I did a video reaction to Floyd Mayweather and how he got his hair transplant to the beard and to the scalp. And, you know, this might be what KSI wants. You know, it's some hairline lowering and some improved beard density. And that's all possible through the FUE method, where we remove hair one at a time from the back of the scalp and move it to wherever we need to put hair. So in this case, it would be sort of his lower cheek area. I wouldn't necessarily start expanding the width of the beard all the way up, because it's going to require a ton of grafts. So if we're looking to put grafts into the hairline and into the beard, and we have to be somewhat conservative with our numbers, right? Because there's only so many hairs that we can take from the back of the head, especially with one session. Another way to do it would be to take individual hairs for the beard and do a hairline lowering surgery. You have to remember, you have to kind of leave some hairs in the back for the future, because even after hairline lowering surgery, sometimes the scar could be somewhat visible, and then you'd want to come back in with grafting at least 4 months after surgery to add hair into that area where the scar is, and sometimes also to fill out the sides a bit.